and this is supporting the caregiver. Martha Raymond and Jasmine Greenamyer are going to do a deep dive into the role of the caregiver and how best to support them.
Good morning. My name is Martha Raymond. I'm the founder of the Raymond Foundation and executive director of the GI Cancers Alliance. And it's our pleasure to be here today with my friend and colleague, Jasmine Greenamyer, for the GI Patient Summit, hosted by our friends from the Ruesch Center and Hope Connections for Cancer Support. Jasmine and I are here today to chat a little bit about the important role of our cancer caregivers and to talk about the partnerships that are formed and are forming that help our caregivers in the important work that they do. So Jasmine, I'll turn it over to you to introduce yourself.
Thank you, Martha. I'm very happy to be here and to have this conversation. So I'm very fortunate. I am the Vice President and Head of Global Strategic Partnerships at EMD Serono. And EMD Serono is a healthcare company, a biotech company located just outside Boston, Massachusetts. And I oversee our Embracing Carers initiative. It's a global initiative where we get to work with the leading advocacy organizations as it relates to family caregiving. I also oversee our Healthy Women, Healthy Economies initiative, and there's obviously synergy, right, as we think about family caregiving and the disproportionate role that women often have in caregiving.
Great to be with you today, Jasmine, and for all of my advocacy colleagues. Many of us know Jasmine from her years of work in the advocacy space and as a mentor to myself and many of us in the community. So it's just great to be here today with you. I guess I'd like to start just on a personal note, and then Jasmine, I definitely would like to turn it over to you so you could share more about the important work, Embracing Carers and the Caregiver Index that you've worked on during COVID, which I know is so important. For me, caregiving dates back many, many years. Both my parents passed from colon cancer when I was young. So I became a very young caregiver for them. And then most recently, my sister passed from colon cancer last year. And as Jasmine and I will discuss, especially with COVID, trying to be a caregiver at any time is not easy, but especially during COVID, when you can't be with your loved one so often is so difficult. And so I think this is a very timely conversation, and look forward to learning more from all of you, and especially from Jasmine as we have our conversation. So Jasmine, I guess, could you give us an overview of Embracing Carers? I know it's such an important initiative and really globally has received so much attention. And, are there ways that all of us can not only learn from the materials, but become involved as well?
No, it's a good question, Martha. So we as a company initiated Embracing Carers in 2017, and it was feedback directly from patient advocacy organizations because they alluded to the fact that they saw the importance of family caregivers, right? A patient in survival would be the first to tell you how meaningful the cancer journey is and how helpful it is to have a family caregiver right there by your side from the beginning or at any interval throughout the journey, right? So we got that direct feedback. But as a healthcare company, we saw two items. One, family caregivers obviously can help with the adherence to treatment or the access to treatment, the research to treatment, the shared decision-making around treatment or transportation to clinical trials, or comprehending, understanding what you've just heard as you're getting this initial news or as you're having to navigate all the layers related to cancer treatment, right? So there's the role with the healthcare system. But the other thing that I think is really neat about our company's approach is looking at the distress that family caregivers often face emotionally, physically, or financially as they go on this journey with their loved one, right? And so what we wanted to lean into is better understanding and bolstering support for family caregivers. And you alluded to this in your opening remarks that as the pandemic was starting to unfold, we as a team got together and thought about how is this affecting family caregivers who are having to navigate the pandemic? And we saw it as an opportunity to do a global survey to hear directly from family caregivers about how they were being impacted. And let me tell you, that was one of the top findings. We were surprised to see it corroborated as much as it was, that cancer caregivers felt more emotional distress than any other type of caregiver, including Alzheimer's and dementia, which I was like, I wasn't expecting it to that degree. We also saw that cancer caregivers felt emotionally isolated more so than others. And we had an overwhelming percent, 94% indicate, I wish there was more accessible mental health support. And whether that's talking to someone who's like me, or just able to say, I need to vent in a place and be able to, navigate through this confusing information, or figure out how to get, PPE, or, what are just resources for me as I'm dealing with my own anxiety that I'm not trying to not put on my loved one or patient, right? So that was some of the key findings, and I'm willing to talk a little bit more, but that's why, just as a company, we really wanted to lean in to better understand how we could support family caregivers. And part of why I feel so lucky to have this conversation with you, partners like you, is we know you're the experts on the field, right? I mean, it's only as good as the partnerships that we have.
And I think that's so important too, is the whole aspect of all of us working together, whether it's industry, advocates, our support centers, especially that help not only the patient, but the caregiver. But I do think it's conversations like this that can really help caregivers feel like they're not out there alone, and that others understand what they're going through. And I think especially with the pandemic, and those findings are so interesting, Jasmine, from the index study, that having just gone through this, I think too, during the pandemic, I would agree that adding that extra layer of, can I go to the hospital? Can I go, when hospice was called in, all of those things, I think it just added that extra layer on top of everything else, where you're trying to be that rock for the person. And hopefully we've all learned, from that experience.
Yeah. And Martha, first I was remiss in not acknowledging your loss, right? So I'm sorry for you and your family. And I've just always been deeply respectful of the work that you've done, but adding that, that layer of personal connection to this has got to be immense. I'd be curious, with your years of experience in the field, how do you think that healthcare professionals can better involve family carers right there at the point of, some of those crucial appointments?
I think we all realize that the caregiver is that extra set of ears in the room, or the individual that can say, I'm on top of these appointments, or if it's oral, chemotherapy at home, I'm going to make sure that, my loved one adheres, to the treatment plan. So I do think that caregivers really have, like I said before, kind of come into the forefront, and are part of that crucial team now. And I think that's a long time coming, but I do think it's great that in partnership, we've all kind of made that happen. Years ago, like I said, 35 years ago, when I was much younger and a caregiver, for my mom, I was in college. Back then, caregivers weren't, you weren't even recognized really, unless you really spoke up. And so now I think that it's really been a shift, and it's a great thing to see, I think, because I think if we're putting our patients first, the patients feel much more at ease, realizing that they have somebody right there with them that understands and that will be their voice if they can't or are not able to speak up at the time. So I really think it is collaboration and partnership, and that will continue to move things forward.
Yeah, I agree with that. And I want to pull the thread on one part of what you alluded to, because another interesting finding for us was seeing there's somewhere a disconnect where overwhelmingly family caregivers were saying they didn't feel like healthcare providers were acknowledging them. And that was a bit of a surprise because I, similar to yourself, thought we've done so much as a community, right, to be advocating on this. So either caregivers aren't feeling that, or, I'd be curious where that tension is. And we're trying to currently do some various partnerships to better understand how healthcare providers can be more impactful, or have the message resonate where they're acknowledging family caregivers. But the thing that really struck me in that is, again, pulling the thread that we saw in communities of color, that it was even more likely that they would say that they didn't feel acknowledged in these healthcare meetings and appointments, and that they were asking for more, not just emotional support, but financial support, just having resources that are specifically given to family caregivers. And so I thought that was an important finding. And one area that we're really leaning into as well is there mental health support, or referrals that can be given to family caregivers, when they're in these appointments. And I know there's quite a burden put on healthcare providers and the system at large, but just even some type of acknowledgement, like, we see you, we value you. Is there anything that you need in this? And similar to the work, Martha, that you were such a vanguard on patient navigation, is there also caregiver navigation that can be happening? To talk about the various individual or family or community resources that can be helpful.
So many important points, Jasmine, that you brought up. And I think one thing I would add, and especially to the work and the findings, that caregivers maybe feel that they're not heard, maybe from healthcare professionals. And I do think that that kind of outlines the more work we have to do. So important, because I think just like we try to help our patients learn the skills so that they can be part of the team and communicate with healthcare professionals, maybe this is an opportunity for us to bring our caregivers together and say, here are some tools that will help you be part of that team, and kind of know what questions to ask and when to, I think so many times all of us, we're a little hesitant to speak up sometimes. And I think that that's part of that whole educational process and empowerment, is to be able to say, there's no dumb question. If you feel it's important and the patient feels it's important. So I think that does give us that opportunity. And the other thing I would say too, as looking at, sometimes the inequalities in healthcare for persons of color, I agree. I think it's not only with the patients that feel that sometimes they're not listened to, but definitely with the caregivers. And so I think there's a lot of work that I know so many of us are trying to do and wanting to make a difference in many different communities that are just not, unfortunately, the health equity is just not there at this time.
I agree. And that's where to your point on partnerships and convening roles, this is where I acknowledging the Ruesch Center and its support of the GI Cancer Alliance, that's a very important resource, because it's a very interesting cross section of stakeholders that are at the table there. And, I think it's a combination of that personal individual advocacy that you alluded to. Here are some questions that may be helpful to you as you intersect with the healthcare team. But I'd also encourage the GI Cancer Alliance to advocate for system change too, right? To have referrals and supports for family caregivers, or minimally to encourage them to say, like, if check into the resources your employer might have, or be aware of different advocacy organizations that could help you. There's cancer specific organizations, but there's also national caregiving organizations that can be very helpful for that. And I know the GI Cancer Alliance, has pulled together some of those various resources. There's also different resources that we highlight on our embracingcares.com website as well.
Again, I think that's just so important. Underscores that, no one's alone out there. We understand, and that together, we can make that difference. Well, it's just been great chatting with you today, Jasmine. I know we could go on, and I hope we'll be able to continue our conversation, down the road, and who knows, maybe work on some things for our caregivers, and educational and empowerment tools together. That would be wonderful. And again, for individuals that want to learn more about embracing carers, what is the website?
Yep, it's embracingcarers.com. Thank you for asking that. And I would also allude to, we're not just looking at the data and the findings we saw around mental health support. Later this fall, we will be launching a Help Not Hugs campaign, where family caregivers are going to be leaning into sharing some of their stories to just normalize the "you're not alone" factor, but also to be advocating for more accessible mental health resources. There are some mental health deserts in the United States and other places in the world. We see the role of employers and healthcare professionals in holding hands to better support this often invisible group that does feel isolated and as if they're the only one who may be experiencing this, or feeling guilty in experiencing this. So information about that will also be on our embracingcarers.com website later this fall.
Look forward to that. And again, it's been wonderful to be with everyone today. And thank you to the Ruesch Center and Hope Connections for Cancer Support. Thank you.